Hello, everybody, and welcome to PathoLogic. Today we're going to be discussing causes of edema. To understand edema, we first have to understand homeostasis. So, at homeostasis, there's a small amount of fluid that leaks constantly from the blood vessels into the interstitium, which is the space between cells. This fluid helps deliver nutrients and oxygen to the tissues. There are four main factors involved in maintaining fluid homeostasis, and they are hydrostatic pressure, aka blood pressure, the gaps between the endothelial cells, which are the cells lining blood vessels, interstitial and plasma protein concentrations, and finally the lymphatic vessels themselves. We are going to use this diagram to describe the changes that are occurring in edema. So note the four main factors that are shown here. We have the lymphatic vessels, the interstitial and plasma proteins, hydrostatic pressure within the blood vessel, and the endothelial cell gaps. So the first factor that we're going to discuss is hydrostatic pressure, which is also known as blood pressure. Under normal circumstances, blood pressure pushes a small amount of fluid into the interstitium, and that fluid is escaping through the second factor, which are the gaps between the endothelial cells that are lining those blood vessels. These gaps are typically small and only allow a small amount of fluid to exit the blood vessels into the interstitium. There's also an osmotic gradient produced by proteins within the blood vessels and then within the interstitium. At homeostasis, there is a slightly higher concentration of interstitial proteins, so a small amount of fluid wants to try and escape those vessels to try and dilute out that protein concentration that is higher in the interstitium. The relative concentrations of interstitial and plasma proteins can therefore affect fluid movement across the vessel wall. Finally, excess fluid is going to drain out through lymphatic vessels to return to the circulatory system. Any changes in the lymphatics can affect their drainage capacity and potentially result in edema. So, with that out of the way, we will discuss the four basic mechanisms of edema, starting with increased hydrostatic pressure. So, increasing hydrostatic pressure, which is also known as blood pressure, is going to force more fluid out of the vessels, even for the same endothelial gap size and osmotic gradient. Since the lymphatic drainage can only drain so much, that fluid is going to begin accumulating within the interstitium, and we're going to see that as edema. We can see increased hydrostatic pressure edema in conditions like pulmonary hypertension due to heart failure, portal hypertension from hepatic fibrosis, local venous obstructions like those that occur when vessels are twisted, such as in gastric dilation and volvulus in dogs, as well as in thrombosis, where there's an obstruction within the vessel itself, causing a backup of fluid, or fluid overload, which can occur from excessive fluid administration, usually through an IV method. Again, the mechanism behind it is that increased hydrostatic pressure is going to push more fluid through those endothelial gaps, resulting in higher fluid concentrations within the interstitium. That is then going to overwhelm lymphatic drainage capacity, causing fluid accumulation and edema. Next, we have increased vascular permeability. This occurs due to larger gaps between the endothelial cells, allowing more fluid to leak out, even at the same hydrostatic pressure. Causes may include infectious diseases that damage vessels, such as erysipelathrix in pigs, malignant catarrhal fever in ruminants, or neorickettsia in horses. Immune-mediated diseases that cause a type 3 hypersensitivity, such as purpura hemorrhagica or feline infectious peritonitis, can also result in vascular damage and widening of those endothelial cell gaps. Finally, anaphylaxis can also trigger widening of the gaps and cause widespread edema. In this form of edema, the larger endothelial cell gaps allow more fluid to enter the interstitium, even at a consistent hydrostatic pressure. And again, that's going to overwhelm lymphatic capacity, resulting in fluid accumulation within the interstitium. Next, we have decreased oncotic pressure. So this results from loss of plasma proteins in the blood, resulting in a higher relative concentration of interstitial proteins. This is going to pull more water osmotically towards the interstitium as it attempts to dilute out that higher protein concentration. Potential causes include decreased albumin production from liver disease or malnutrition, or conditions resulting in excessive albumin loss, such as the protein losing conditions like parasitism or protein losing nephropathy. Water toxicosis can also cause decreased oncotic pressure because it basically dilutes out the blood, which is then going to lower the relative concentration of plasma proteins, despite having no actual loss of those plasma proteins. As mentioned, this condition results from lower plasma proteins within the vasculature, which is then going to trigger more fluid to enter the interstitium to try and dilute out the interstitial proteins that can't move back and forth across the vessel wall. Since lymphatic drainage capacity is exceeded, this again is going to result in fluid accumulation and thus edema. Finally, we have decreased lymphatic drainage. Anything that obstructs lymph outflow can cause fluid to accumulate within the interstitium. This can cause edema even at like a normal level of fluid entering the interstitium. Potential causes include compression or obstruction of lymphatics from neoplasia, inflammatory masses, or fibrosis. It can also occur from lymphangitis, which is inflammation of the lymphatic vessels. Finally, in some animals, there may be aplasia or hypoplasia of lymphatics, which can cause edema because there's inadequate lymphatic development for a particular area. So, the basic cause of this type of edema is simply blockage of lymphatics, thus resulting in fluid accumulation due to inadequate drainage. Here's a brief summary table of the types of edema and the potential causes that we discussed in this video. Thank you for watching Pathologic, and we will see you in the next one.